Hi, Dr. Baumholtz, Baumholtz Plastic Surgery, and let's talk in a little detail about a breast augmentation procedure. So typically what happens is I will meet you the morning of surgery at the holding area of either the hospital or the surgery center. I'll ask you to take your top off and I will draw some lines that will guide the surgery because when you lie back, some of the reference points change. You then get a little cocktail in your vein, as the anesthesiologist will say, and we do have a board-certified anesthesiologist to keep you safe. You're then brought back and positioned in the operating room. The surgery itself involves making an incision at the appropriate distance from the nipple down to the fold. I like an incision down here. And there's lots of different places. You can come from the armpit, you can come around the areola. What I will tell patients is that I think this is the most versatile of all of the incisions out there. Because at some point in your life, you will likely need something else done, and I can use that incision over and over again very safely. If I am adjusting the fold to accommodate a large implant, I may want to lower the fold, and this is the most direct way to do that. When I make an incision down at the bottom, I come down to the level of the muscle. I do tend to put implants under the muscle with some rare exceptions. We can talk about them when we meet in person. But we put it under the muscle, we lift up the muscle, we put the implant under the muscle. We use a pretty fancy device called a Keller funnel. And there's another brand out there by Implant. They're both good devices. And what we can do is we can project or propel the implant from the outside into the inside without it having to touch or scrape against the skin and potentially pick up some bacteria on the way in. Once it's in, we make some minor adjustments out here to the sides and then sew it closed. And we sew it closed in layers. First, we try to recreate the inframammary fold. Then we close the skin in 2 layers, put a little dressing on, and that's a breast augmentation procedure in a nutshell. I hope that answers your question and have a great morning. Take care.